Good afternoon, everyone. My name is Blaine Doyle, CEO of ChektAhora. Traditionally, we were a direct-to-consumer women's health brand, I suppose pre-COVID, and we've now moved into COVID testing since we are equipped to do so. So we're moving from protecting women's health to protecting a nation, that nation being Mexico. Right now, Mexico has just crossed the threshold of 35,000 confirmed cases, which puts us in the region of around 350,000 active cases of COVID-19 in the country. Mexico is one of the countries also with some of the highest high-risk groups within the country. Our solution to this is a fully accredited qPCR solution, enabling on-site sample collection and turnaround in 48 hours. We've got all the local registrations, COFEPRIS, PACAL, and also an ISO registration and the necessary INDRE approval, which INDRE is similar to the Mexican CDC. How we're doing this is first through digital sales with homes collection. We just partnered on something there with that. Also through volume from private healthcare partners, corporate partnerships, ensuring the coverage of employees, and also we're just beginning to look at importing samples from the USA. You might ask why we're even importing samples on top of these other three strategies, but it's because we've got a ferocious capacity of 504 samples per day, which we're beginning to move to doubling that in the near future. Right now we're operating at a cost of goods of $47 per test, with a 65% margin on top of that. That's roughly $135 price per test to the end consumer. So we're just creeping up on $125,000 of revenue this month. We're looking for this to peak in July and then grow steadily through our sexual health business over the course of the remainder of the year, with kind of 2020 wrapping up with $1.8 million in total revenue. Over the course of the next 5 years, we're looking to expand further our women's health business, while also focusing on fertility and reproductive health. We look to expand into Bogota next year, Sao Paulo the year after, and Chile the following year, building the company's revenue to a total of $30 million in 2024. We've basically got a stellar team in Mexico City, ranging from experience in the medical industry, academia from the London School of Tropical Medicine and Hygiene, at the NHS, and then corporates like Roche, Danaher, and Abbott Diagnostics, as well as even Sava, one of the largest tampon companies in Mexico, because of course we are a women's health company. Our existing investors range from corporate VCs, VCs like SOSV, to angels like Dr. Johnny Walker, who's had a successful exit recently, John Toohey, who also had a successful exit recently, Dr. Donald O'Shea, who's exited 3 times in the diagnostic space, and Philip Noon, who's a successful executive from Quest Diagnostics and has also exited a diagnostics company in the past in the point of care space. We've actually just closed, or are closing, our Bridge to Seed round. It's $500,000, $100,000 coming from a follow-on VC, so an existing VC who's invested, and $400,000 coming in from a family office based in Dublin, who's basically, I suppose, supporting us in this round. We are open to oversubscribing this round, so still interested to get in touch with investors and hear what's possible from them. Right now we're looking at scaling sample collection, supporting the rollout of COVID testing, launching a telemedicine revenue channel, which will link into this COVID testing, and basically finish out our national reach within Mexico so we can begin looking at international expansion. Effectively, the world has changed, and we need to be united, separately. ChektAhora is a way to do this. Thank you so much for your time. My email address is just below on the very bottom of this slide, and I would love to get in touch with some of you. Thanks so much.